we are having Dr. Wanda here. She's going to talk about and address certain myths, some truths, yes, about breast cancer. And she's also going to address some untruths about breast cancer.
My name is Dr. Wanda. I'm a clinical oncologist. That's a doctor who's able to treat cancer using chemotherapy and radiotherapy. Also a sign language interpreter, passionate about cancer advocacy and creating awareness. I believe we don't talk about cancer enough. I think that's what makes us have the late presentations that we see in our clinics. And I'm happy to be here because I know this is a platform where people join, people will learn, and we can sort of demystify some of the myths that people talk about. It's an opportunity for people to meet an oncologist so that they know how we look, so that they're not so scared. They can realize we are human beings, we are normal, we can show up on TikTok, take some time in our evening to show up for such a meeting. So I guess this is a good opportunity to ask questions, a good opportunity to learn.
Somebody yesterday said, oh, thank God you already had children of your own before cancer. So what stands out for me is in relation to breast cancer, people think that there is a way in which without breast, in cases of mastectomy, then somebody cannot have children. And I think that is common and basic biology, but I think they don't trust me because I'm not a medical doctor. So can you please help people understand how breast is not tied to pregnancy?
Oh, that's a good place to start. I think why that misconception might be present is because we look at breast as sexual organs. The truth of the matter is that breasts are axillary ducts. So it's a collection of ducts. The reproductive system for a woman is the eggs, which are found in the ovaries, and then there's a fallopian tube, and then there's the uterus. So even if you have a mastectomy, it is very possible for you to carry a pregnancy because the egg is produced from the ovary, the baby is carried in the uterus, so you can have children. There are certain women who have cancer diagnosed in pregnancy. It's a common phenomenon. We have women with diagnosed breast cancer when they're pregnant. In the second trimester, we're able to even give chemotherapy, and they're able to deliver children who are perfectly healthy. So it's good to note that breast cancer can happen in pregnancy. After treatment with chemotherapy, it's possible to have a child. We have patients we've treated who have had babies years after the treatment. So it is possible. So having a mastectomy doesn't mean you can't carry a pregnancy to term, doesn't mean you can't have children. Some of the treatments we do give, truth be told, can sometimes reduce maybe the number of the ovaries, the eggs that are present, can reduce your fertility, can reduce your interest in sex, but there is what we can do. If you're in your reproductive age group, there's a lot that can be done in terms of preservation of fertility, so that you are able to conceive thereafter. And that's why I say it's very important to speak to your doctor and be very open. I want children after this. So that's a conversation we can have from the onset of treatment. And we can put the interventions in place to ensure that your fertility is preserved.
Okay. Yeah, and that leads to the other question, of course, that I asked you about the fertility bit, because apart from them talking about the pregnancy, they also normally talk, about do you have feelings? So again, the thought of having gone through cancer, taken out the breast, and then seeing the breast as a sexual organ, they associate it like, oh, Candid Diana can never have feelings. So I believe when they say, do you still have feelings? I think what they believe is the sexual attraction, or maybe to my husband and all that. Would you help them explain that? Because now me sometimes I've always been like, he's still with me, oh, he has not left me. So how can you easily teach
He
them
better not.
What can you tell them about that? And if you
So
can
not having breast.
some of the intervention that you guys do superficially, what is it? Yeah.
All right. So having a mastectomy does not stop you from being human. So you're human. As long as you're alive, you definitely have feelings. You can feel pain, you can feel happiness, you can actually also have sexual feelings. This is because we have not taken out your sexual reproductive organs. And even for those who've had their ovaries removed, they're still able to engage in sexual activity and derive pleasure. Remember, sex is not just the penetrative action, it also comes from the mind. It starts from the mind. There's the psychological aspect towards it. And for women, that's even more stronger than for men, because men see and are able to have an erection immediately. But for women, sexual matters are more, they start from the mind. They start from where are you in terms of your feelings, what have you had? And that's why we say men get aroused by what they see, women get aroused by what they hear. So that's why you'd find a very beautiful woman, and sometimes you're looking at the man, you're like, well, how did that happen? So feelings are cultivated over time. So once you have a mastectomy, it does not stop you from having romantic feelings. It does not stop you from loving, it does not stop you from enjoying sex. However, what we need to really focus on is the mental attitude. Sometimes when one has had a diagnosis of cancer, the stress that goes with knowing you have cancer sometimes takes your mind away from the physical attraction. And at that time, the focus is fighting the disease, going through the treatment, taking your chemotherapy. However, what we strive, or what I strive as an oncologist to say, cancer does not define who you are. It's like saying, I am a malaria survivor, or I have malaria. We don't keep saying we have malaria. We don't keep saying I had diarrhea at some point. That's just to say there are things that happen in our lives that are phases. Your life as a wife, your life as a husband who had breast cancer needs to go on. Your sexual life, your responsibilities as a mother, and your responsibilities as a wife need to go on despite the cancer treatment. So the notion that they don't have feelings is something that's quite wrong, because any human who is alive, you definitely have feelings. Like if I pinch someone, they'll feel pain. So there are also, anybody who's gone through cancer treatment can have emotions, love, hate, anger. They're human. We need to just have that as a concept, that they're human. So Diana is human. For those who are asking, yes, she can be able to feel. Yeah, she can enjoy being a married woman, and that's a good thing. So imagining that she would not have feelings is quite wrong, because it sort of dehumanizes the person, makes them feel like they're not human, whereas first things first, they're human. And cancer does not define the person fully.
Thank you. Thank you so much, Doctor. And you have mentioned, when you are talking about, you talked about the feelings of a wife after they've had breast cancer, the feelings of a husband after they've had breast cancer. Now, that is another misconception, because you find men coming even to my inbox and saying, thank you so much for encouraging our women who can have breast cancer, encouraging our women about breast cancer. The notion that breast cancer is only something that affects the women. Yes, I know women are affected more, but from a doctor's point of view, an oncologist, can you talk about breast cancer in men so that men can know, look, this is something you can also get, and what kind of tests or diagnosis are done for men? Because I know women will go for the mammogram. How can men go, especially if they've had history in their family on breast cancer?
So that's a good question. And I think whenever we talk about breast cancer, it's always thought to be a female thing. It's always conceived to be something for the women. I guess even the color that was chosen, pink, has something feminine about it. However, men, first, let's begin with men have breasts. Yes, men have breasts. They're not as large as breasts for women because they lack the fatty tissue that makes our breasts larger. But they have breasts. I think let's agree with that. So they can get breast cancer. If we compare the percentage, it's about 1% of breast cancers that are all there are male breast cancers. Sadly, it's more aggressive in men because they do not have space. You see, as a woman, you have breasts. So if there's something growing, a mass, there's tissue for it to grow inside the breast without going into the rib cage or going into the lung. However, for men, they lack that space. So when there's a tumor, it goes very quickly to the ribs behind, it goes into the lungs. So it becomes more aggressive in men, and majority of the time, sometimes we catch it very late. So what should we do? I always say men need to have a good relationship with their mirror. I think women have a good relationship with the mirror. We need to learn to look at ourselves in the mirror. Just like what we say for women, look at your breasts. If you notice one is larger than the other one, then you need to get checked. what's happening in that breast that has become larger. If you have a breast discharge or a swelling or something like a pimple or an ulceration, then you need to get it checked, because it means something is happening in that breast. And something we need to say, because one of the myths is that cancer is painful.
Yeah.
Cancer is not painful. Cancer is not painful, and that is why people come late. You see, if something is painful, it will take you to the hospital because you'll not be able to go to work. But cancer, most of the time when it begins, it's painless in the early stages. So that means you will not know you have it until you go for a biopsy. So if you notice within your breast there is any hard feeling, you feel like there's something hard within your breast when you examine. If you notice like a rash, a change in skin color, if you notice when you press your nipple, there is a discharge coming out, either milky, blood stained, fluid coming out of your breast, it's important to get it checked. And for men, we might not be able to do a mammogram because the mammogram involves compressing the breast between two pads. So for a man, you might not be able to do a mammogram, but we can do what is called a clinical breast examination, where a doctor examines the breast. And because we've examined many breasts, we can be able to tell when something is suspicious. And we can also do an ultrasound for the man. And an ultrasound will be able to show us what's happening in that male breast. So it's good to note that it's more aggressive in men. It's a smaller percentage, but it does happen. And men should check their breasts too, so that in case there are those signs that there is breast cancer, then we can catch it early.
Something that came up during my own treatment, because I got diagnosed after a hormonal treatment. I had endometriosis, and I was being seen by a doctor in Nairobi when I came back to Kenya for about 3 years. And I went in for a laparoscopic, surgery, and then it ended up, oh, you have endometriosis. They took out whatever they could, and then he put me on medicine. I wasn't reading those leaflets or the covers at that time, but I was put on a treatment for 6 months, and because I'd not done the family planning swallowing tabs, they told me, oh, it's just like family planning, but you're going to take it for 6 months to clear whatever is left. So I took that for 6 months, but because I'd been in the US for some time and I saw the way they put the history, and I had already Candy, the older one, I said, you know what, let me carry this packet and all this information when I'm coming back, so they enter it in my history. So when I was diagnosed, this is something that my oncologist mentioned, because I was like, what caused this? What caused this? And then, we can never pinpoint what exactly caused it. But some of the things that, linger around here is you are on hormonal treatment. And that is what came up for me. And I was like, hormonal treatment where? You are on a family plan? No, I've never taken family planning. Then they took me back to what was on my chart. I said, oh, that one was for endometriosis. Then they told me, yes, it was hormonal treatment. Now, I know several women take hormonal treatment for birth control. And my doctor told me there are usually other options that can be given for birth control that are not hormonal. Would you talk about how hormonal treatment can lead to breast cancer, especially the hormonal receptors? And what questions can they ask their OBGYN regarding their birth control, at least not to increase their risk?
Okay. So that's a good question. Hormonal influence on breast cancer is present. It's not present for all breast cancers. There are certain breast cancers that are hormone sensitive, that when there is estrogen or progesterone, then it sort of serves like a fuel. So we call those hormone receptor positive breast cancer. So it has been noted to be a risk factor, that if you have been exposed to hormonal modulation, then that can happen. For people who are menopausal, if you have hot flashes or a lot of the symptoms from menopause, then sometimes we prescribe hormonal replacement, meaning we give you estrogen, and that has also been shown to have a risk of development of breast cancer. However, there are certain, for the conventional types of hormonal type of family planning, the risks are present, but it is worse. For example, if I am going to be popping an emergency pill every weekend, because I've met up with someone, then the emergency pill has a very high concentration of hormone compared to the daily pill you take every day. So what we advise, if you're going to have sex on the regular, then an emergency pill, it's not an emergency. Meeting up with your boyfriend or visiting your husband who's abroad or coming back from the army who has been away from home, it's not an emergency. It's actually a planned event. So you need to be on contraceptive on the regular as opposed to taking the emergency pill on the regular. Why the emergency pill was actually put in place, pretty much the thought behind it was in case you're raped and you don't want a child out of that because it would be traumatic. But it wasn't designed to be something I take 2 or 3 times in a month because of the amount of hormonal content it has. If you look at your menses after you've popped a few emergency contraceptive pills, you would notice your cycle is off the charts. It doesn't take the regular amount of time. So that means you're interfering with the normal levels of hormones in your body. So if you do know you have taken more than 1 emergency pill in a month, then it is high time to look for a method that is more regular than the emergency pill. Then there's what is happening in Kenya. There are some drugs that people are taking, that 1 pill for a month. Like you take 1 pill and it's family planning for the month. It's not sold in any chemist. So it's sold person to person from a certain, maybe a vegetable vendor, and people are popping that pill. And that is because people are imagining if you have a pill, 1 pill in 1 month, it sounds ideal as opposed to taking a pill every day. However, it has a high amount of the hormones. So that is a risk factor and people need to know. And it's not been licensed. It's not been like accepted. It's not gone through Kenya Bureau of Standards. It's not gone through anything that is going to confirm whether it is correct and safe. And that is why it is not in any chemist. So it is very important for us to know that those pills that are not regulated are not safe. We should not take them. We should actually tell people to be discouraged from it. Diana looks shocked. She doesn't know, but that's actually happening, and we are concerned as doctors of what it will do in future, and not just for breast, even for the endometrial cancers, because they are hormone modulated. So it's important to note that there are risks. So when we look at non-hormonal methods of contraceptives, then we're talking about condom use. We're talking about intrauterine devices that are non-hormonal, because that's like a coil. It's commonly called a coil in Kenya. So there are 2 types of coil. There is one that has hormones and one that does not. So in a case where someone has a challenge with hormone receptors, then we can advise for non-hormonal types. We also have barrier method that's there. There are spermicides that are a cream that can be put in the vagina. And that can help a person who is not able to take hormone receptor positive, or their cancer is hormone receptor positive, or they're at a higher risk than the general population, maybe because of family history.
Wow. Yes, I'm shocked. I didn't know that people can just take family planning pills from vendors, from anybody. And that to me is carelessness. And I think some people don't see it as carelessness. Then they will ask, why is it that so many people are getting breast cancer or cancer nowadays in Kenya? That's it. That's it, guys. Let us take care of ourselves. Let us take care of ourselves. You know our system, and that's something else that I'm going to ask Dr. Wanda. You know, especially the system in Kenya. You know, especially for the poor person, you know how delays can happen. You know how you may get some services in one center and other services are not there. You have to go to another place and you have cancer at that time. So prevent it. Prevention is better than cure most of the time.